They will be looking a little bit wider at first, and
Can you get a top surgery without testosterone?
depends on patient.
Hello, Dr. Turgut Kayadibi.
Hello, Zubeda.
What is an FTM top surgery?
Female to male top surgery is actually removing of the breast gland tissue and repositioning of the nipple. It depends on patient. In some patients,
What technique do you use?
it depends on patient actually. It depends on the volume of the breast tissue. In smaller breast, we use periareolar technique, which there won't be an extra scar. Just around your areola, there will be a scar. If you have so much skin and breast tissue, we need to do double incision or single incision mastectomy.
What do the nipples look like after the surgery?
They will be looking a little bit wider at first, and they will be around 3 cm in diameter, but it depends on patient's body status. In some patients we can leave them a little bit bigger, and in smaller patients we can make them smaller. It depends on the anatomy of the patient actually.
Can you get a top surgery without testosterone?
I recommend using testosterone at least for 3 months, same as females also for MTF patients, because it will make your breast tissue smaller, so we can make smaller incisions and we can remove them more safely actually.
If the patient used testosterone, do they need to stop it for the surgery?
About 1 week before they should stop, and actually we need to see the blood results first, because in testosterone users, their hemoglobin levels can get very high, so they should be under vision of an endocrinologist. So we need to see them before.
Is there a weight limit for the surgery?
Of course, if your BMI is higher than 30, I don't recommend to get surgery. You should get a weight loss before, so your scars will be healing better, and risk of bad scars and dog ears will be less.
And what is the best age for the top surgery?
Depends on patient actually. They need to be sure, and they should get a psychiatric consultation before. So they need to be sure actually. This is a major surgery, and we are removing an organ, their breast tissue. There is no coming back, so they need to be sure, and they should get first psychiatric consultation.
And there are also some patients who are already in transition when they are a minor age.
Yeah.
Can this surgery also done on the minor age, or they
No.
have to be 18 plus? Is top surgery painful?
It's a mastectomy surgery actually. It's painful, not as painful as liposuction, for example. And also pain tolerance depends on patient.
How long is the recovery for the top surgery?
Recovery is relatively easier. They will be wearing a bandage for upper part, and they will use it for 6 weeks. They need to be positioning their arms carefully for the first 3 to 6 weeks again, and actually it's relatively faster.
How soon the patient can go for workouts?
For upper workout, they should be waiting for at least 6 weeks.
How long after the surgery can lift your arms?
You can lift up to that part, but I don't want you to make this maneuver for at least 4 weeks.
How long does the surgery take?
Surgery takes around 1.5 hours. It's relatively a shorter surgery.
And what is the risk of the top surgery?
You can have collections. For example, seroma is the most common collection. There will be a dead space here. We have special techniques to reduce this. We always use them. The most common thing that you can see collections actually, and you will see fibrosis in the first early period. If you get a good massage and good aftercare for the bandage and pressure, it will be relatively low.
Does the patient keep nipple sensation after the surgery?
That it will be less. It will be less than before, but there are 2 types of techniques that we use: pedicles for removal, or we use nipple grafts. If we use nipple grafts, there will be no sensation. In pedicle techniques, it will be less, but it will be present.
Thank you very much for your explanation.
See you.
Bye.